next, we start our conversation on dengue fever. If you've not heard, well, there's an outbreak in our country. In some regions, a number of people already having fallen victim. And it applies just like malaria. It's just that this time it could be more severe. Listen to this.
But like I said, because majority of the cases are mild or moderate, painkiller is sufficient to, paracetamol is sufficient to alleviate the symptoms, particularly once they are educated. So the region, after the confirmation of these cases, have taken certain actions, which are important because we need to know, we get people, the public, first well informed about the disease and reassure them. For us, the good news is that no one has died out of this disease for now. So we need to continue to support and then treat the patients so that we do not record fatalities. The mosquito population, yes, the weather, that's part of it. You know, we're in the rainy season, and mosquitoes need water to breed. So the rainy season, wherever water collects, including if we're eating fish and things and we do not dispose of them well, lorry ties, even plantain.
Well, there you have it, that release yesterday on the state of affairs. Joining the conversation, we have Dr. Franklin Esiedu-Bekwe. He's Director of Public Health with the Ghana Health Service. Doc, good morning.
Good morning.
It's really good to have you join the conversation. Now, we know that in the eastern region, there has been an outbreak, another 2 added on from yesterday. But what is the latest that you can share with us on this dengue fever development?
Okay, thank you very much, and good morning to your listeners and viewers. So, I think I need to put on record that this is an ongoing outbreak. So, we have the cases going up. I think what I'll need to...
I didn't quite catch that. You have what going out?
An ongoing outbreak.
Okay.
Ongoing, yes. So, and basically we try to do an initial detailed investigation. If you look at where the cases are coming from, they are contiguous districts that extend to the central region. So, the eastern region has Achansi, Achimanso, Brame South, Brame Central, and then you realize that it extends to Achin North. So, those are the enclaves that has the conditions. So what has happened is that we initially we were seen as this is suspected malaria cases, and then when we had the test, it came as dengue. So the central region has also taken samples, and a number of them are positive. So if you look at what we try to communicate, for us there were 2 main attempts for us to get the Ghanaian and into the health system. So one, we wanted to make it very clear that when we have symptoms that are similar to malaria, it's not always malaria. But it's very, very important because if you look at the condition, they were all thinking it's malaria and it's not resolving until we realized that no, it is not malaria. So what we put across is that clinicians should look beyond malaria and look for other causes, where in this case is dengue. So it tells you that we're now focusing on those who had the symptoms that were perceived to be malaria, and then let's test them and see whether it's dengue. So that's one. 2, the population, we want them to understand that it is not every malaria-like symptom that is malaria. So you don't need to self-medicate. For us, these 2 principles are enough to address the outbreak. So it's not just about the numbers, but the understanding that we are having a disease which is similar to malaria, but it's not malaria. And when this is fine with the population and the health system, then we are almost in charge of managing the outbreak. So if that's the understanding, then how do you address it? So clearly, it's a mosquito, but this one is a different mosquito. It's the Aedes, which bites during the day, unlike Anopheles that bites during the evening or in the night. And clearly, it's about preventing the bite of the mosquito. So you need to be sure that you are well clothed and you protect yourself from getting the bite, and then you also minimize the population of the mosquito. So that is the concept, and I think that when it's very clear, it's not about numbers. Then if you have this thing right, it's about early reporting and management. As was said by Dr. Fosu during his press brief, dengue normally is asymptomatic or is self-limiting. So in that case, you have people who are infected and within a matter of 2 weeks, they are fine. It's only a few that get the hemorrhagic type that becomes severe, that they may die. So in this context of our communication, we are hoping that Ghanaians will not self-medicate, Ghanaians will report early, and they will not get a complicated dengue that will lead to death. And that is the concept of our approach to managing this outbreak.
I see. Before we get into maybe because the transmission follows the same mode as malaria and all of that, we also know, and clarify for us, there's no treatment for this. So I don't know whether there would be any prophylaxis or prophylactic treatment. So there's no treatment for it. And like you said, for some people, the symptoms may not even show. But while the symptoms may not show in such asymptomatic people, could it just all of a sudden get severe since they already have it, leading to a fatality? Just clarify that for me.
Yeah, as you said rightly, there's no specific treatment for managing dengue. So it's treated by symptoms, so it's symptomatic treatment. But then you can have people who may be asymptomatic, but may have the virus in them, and they can still transmit. So that's why it's important that people will help to suspect and then report to health facility. Because clearly, if you go to a health facility, then you are not likely to progress to maybe the severe type. There's a few instances that people like to do dengue vaccination, but it's not very much pronounced. So the treatment is early detection and then hospital management. It can also be managed, a lot of them in the houses. If you look at this kind of situation, most of the cases are actually being managed at home. And so what is the most important is being able to detect the cases and then making sure that they do not infect others. So those who have been exposed, make sure that they sleep the dead, so that when they are being bitten by they are not able to be bitten by mosquito for them to transmit the virus to another person. So clearly, in terms of transmission, it's about the same as malaria. Yes, that you have different names for the vectors. It's Aedes, this is Anopheles. This one bites during the day, while Anopheles bites in the night.
Dr. Abekwai, so these Aedes mosquitoes, where did they come from? Have they been with us throughout? And I know you said that mostly this dengue fever is asymptomatic, but in the instances where you show some symptoms, what are the symptoms then to look out for? So 2 questions in one. Where do these mosquitoes come from? Have they been with us all this while, and why are they just surfacing? And then what are the symptoms to look out for?
No, Aedes have been with us across the country. I know they are very, very much common in savannah, where they try to transmit more of yellow fever. So we have reasonable number of Aedes. Just that the populations go up and down. So I think that this one, there has been a catalyst that maybe has led to a high population. It's not very clear, but it's not that they don't exist. They exist in Ghana. And then I think your second question was, can you get the second question?
The second question is, what symptoms we should look out for, although majority is asymptomatic,
Yes. So the symptoms is like you have a high-grade fever, so you may have a temperature of maybe more than 38 degrees Celsius. You have headache. It tends to be very frontal, so like around the forehead. Then you may have general bodily weakness. You may have abdominal pain. You may have nausea. You may have vomiting. So these are I would say for the normal dengue. Then, when it becomes hemorrhagic, it may tend to have bleeding tendencies. So the person will now be vomiting blood. It may pass the bloody stools or be coughing blood. So that's the hemorrhagic, and that one, that's the one that leads to death. So what we want to prevent is to get severe dengue or hemorrhagic dengue. but by trying to identify the cases early and then so that they are managed. So that is where we are. But I think that, as I said, based on our investigation, that we realized that there's a tension into, let's say, the central region, and the lab is going to come out. So we will have some cases come from central. But as I keep on saying, for us, the numbers is not the issue. What is most important for us is that the idea for Canadians to understand that not every fever which is malaria, and that applies to the population and also applies to the clinicians.
You said these mosquitoes have been with us for a while. I mean, they've been here, just that it's now resurfaced and the population has been low. So talk to me about any relationship between the increasing sanitation crisis we're experiencing in this country and now these Aedes mosquitoes resurfacing and giving people dengue fever. What's the relationship there?
No, what I'm saying is that we are trying to make a hypothesis. Because we are not an entomologist, so I'm thinking that it's possible that we have gotten a surge in the population of Aedes. That's accounting for this maybe high cases of dengue. But what I'm trying to say is that Aedes has always been in Ghana. If you look at the spread of Aedes across the country, it's almost in every part of the region. The common place has been in Savannah, where they transmit yellow fever, which is quite common. We don't have record of they being dominant in that part of the East region. What I said that it could be catalyst, something that got them up, but for now it's difficult to make a guess. But it's not that they are unusual. But you see, one thing which is important for public health is about suspecting and confirming. So let's say if you don't have a capacity to confirm, you can say that you have unresolved malaria and that's the end. But then because we thought that let's look beyond malaria, and then that's how come we are seeing the dengue. But if you look at the data from our, let's say for the past 2-3 years, I think last year we had 7 cases of dengue. I think last year we had 1. So it's not very common, but it's not uncommon too in the country.
So how fatal is this dengue fever then?
Yeah, so in terms of numbers, most of them are asymptomatic or self-limited. It's just a few that becomes the severe, that becomes hemorrhagic, that you die. So in terms of maybe compare them to maybe things like COVID, this is not like that. But I think what's most important is about how early you detect the disease in the condition and then how you manage them. That influences the outcome.
I'm not sure I got you clearly. Are you saying that the fever is not fatal, or please come again? I didn't get you clearly.
What I'm saying is that the fatality is not maybe as high as compare them to maybe other conditions like Ebola or COVID. But it's dependent on how early you detect it and manage it. So that's why we're focusing on early detection and then management.
Dr. Siedu, quickly before we bring in our regional correspondent as well, I'd just like to find out from you. You suggest that in previous years we've had very few of these cases, but now all of a sudden in one region alone we have such huge numbers, and it appears there may be more. Could you explain, or what is your analysis? What could be accounting for this?
Yeah, so I think that that's why we need the entomologists to explain to us what are the increasing. First and foremost, are there increasing populations of the Aedes across the country? Because they are the vectors. So for me, it's one of the hypotheses we are trying to make. Has it been an increase in the number of Aedes across the country? Who is accounting for it? And why this thing? Is that the normal habitat? So those are the things that we need to ask ourselves. But what I'm trying to say is that it is not that Aedes are not common in the country, but we do not have that record of them causing disease in that locality. But they need to be further investigated.
Doc, please hold for us. Our correspondent may say things that you may need to clarify as well, so hold for us. Let's bring in Kofi Sian. He's our Eastern Regional correspondent. Kofi, if you can hear me, what is the latest from the Eastern region? We've seen the numbers. Are the numbers still same? What is the district director, regional health directorate saying on this matter?
Okay, so Ben, the numbers currently, as I speak with you, are the same. You know, when the Ghana Health Service came out with their statement, initially it was 9, but yesterday at the press conference, the regional director of health, Dr. Winfred Ofosu, confirmed about 11 cases. So for now, the numbers haven't changed. What we know from yesterday is what we are still, discussing in the region. There hasn't been any new cases from the end of the Ghana National Health Service.
In terms of these 11 so far in the eastern region, what do we know in terms of what treatment they are receiving? How are they faring?
Okay, so according to the regional health director, these are cases that are not too severe. That is what he says. And that they are being treated with paracetamol and other painkillers. Because as of now, he says that they have no concrete or special treatment that can be given to these people affected by the malaria or the fever virus. So that is what they are treating them for now until they have or they record any severe case which will require intensive treatment.
Now, for those who have fallen victim and all of that, I mean, then it would put the community on high alert. What has been the reaction from the community? What has been the reaction from the regional authorities in terms of, containing the vector?
Okay, so, about a week or two ago, there were reports from the district mentioned, that is Achimansa, Brim North and South, and those adjoining communities around those places, about the outbreak of some special breed of mosquito in that area. So when the news of the outbreak of the name, I actually forgotten the name of this current virus, the malaria, the fever we are talking about, the people were not really surprised about it because they knew already about the outbreak of this special breed of mosquito. But those of us outside these districts, the 5 districts the Ghana Health Service mentioned, we are a bit taken aback to the current situation because we have not experienced it and we haven't had the opportunity, to hear about the fact that there is an outbreak of this special breed of mosquito. So if you ask me, those closer to the area are not surprised because they have heard about it. But those of us outside the 5 districts are the ones we are surprised and we are taking precaution from what we have heard so far.
And in terms of the authorities, maybe finally, at least from my end, what then is the next step that they are going to take to ensure that this does not become a full-blown, escalated, crisis on our hands? Okay,
so the health director at the press conference said that they are also doing their part. They will be moving from places to places where they hear about anybody who has been affected by this vector so that they can trace all the contacts and make sure that, people who have been affected are given treatment. So he also advised that people who fall sick and have symptoms of malaria and fever can contact the nearest health center, especially in the 5 districts that they've mentioned. People from there should contact the very near health center and report to them about the fact that they having these feelings or they experiencing these symptoms so that they can be treated and be given the right medication.
So maybe my final bit to you, I'd like to find out on sanitation, right? Of course, because it's mosquito-driven, the vector, has there been any commentary on sanitation, fumigation, mosquito nets, any such developments yet, or at least for now, nothing yet?
Okay, so Ben, if you listen to the regional health director very well, these are areas close to forest zones and also areas that mining activities take place. So you have the miners dig their holes and leave them. They do not cover them. So it becomes a breeding ground for these mosquitoes. So what he's been advising is that when the miners go to the site and they finish, all the digging and excavation, what they have to do is to cover these pits so that it will not hold water for it to become a breeding ground for these mosquitoes to thrive. That is what he's been saying. And he also advised that people should sleep in mosquito nets and also get themselves mosquito repellent so that it can ward off this vector and protect the whole community from being affected.
Kofi, we're grateful for your time. Kofi Siao is our Eastern Regional Correspondent. Interestingly, Aedes aegypti, as we've spoken about, transmits not just this. I mean, once it is infected itself, then it can transmit dengue fever, yellow fever. I see this one as what? Chikungunya virus and Zika virus. That one has been pretty prominent in Brazil and other places. But to cap off the conversation with Dr. Esiedu Bekwe from my end, is the malaria control program going to come on board for this, Doc?
Yes, thank you very much. So I need to state that the initial investigation is centered around the malaria immunity program. So they actually led the investigation because it started with the complaint that there are some different breeds of mosquitoes. So they mobilized and brought the entomologists, epidemiologists from their end. So that they are actually leading to support the region. So to us, it's part of the whole approach. And as you said, so initially we were not sure what is the cause of the fever. When you mentioned rightly several pathogens, Zika, chikungunya, they are all part because if it's Aedes, they can be considered by, it can cause only of these diseases. So the website is on the WUCI has the capacity to decide or to confirm which pathogen, and they confirm dengue. But they all fall into a category of what we call the viral hemorrhagic fever. So I think that, let me say that we are still, the program is still doing more investigation with their team to see the extent of the condition.
Right before you go, Dr. Franklin, you talked about investigation, but is there any research going on to look for more effective ways of treating this, or vaccines or anything of the sort?
Yeah. So I think that it's a global strategy on vector control. The idea is which kind of vaccines. As I told you, there's some kind of vaccine around, but the high effectiveness is early stages yet. So there's a lot of work being done on dengue now. It's becoming like a global upset. It didn't seem to get common in the past, but it's coming up. So WHO is leading that front to see how we can curb the incidence of dengue across the world.
Dr. Franklin Esiedu Bekwe is Director of Public Health at Ghana Health Service. Thank you so much for your time.
Thank you.